I think these are all really great questions because I think a big factor of this is shared decision making and making sure that people are informed with the proper data to make the best decision for them and their families. And I think the big thing is although thankfully kids to date have been relatively spared from the worst of COVID, though they are still getting impacted. And although the death prevalence among children may not be at the same rate as adults, we do know that children are getting admitted to the hospital. We do know that kids are not only getting admitted to the hospital, but ending up in the ICU and requiring mechanical ventilation with a breathing tube. And although death is not thankfully, not the most frequent outcome for those situations, the idea of having a child end up in that situation, although they recover, that can leave a physical and emotional scar on the child and children of the family and the child. And if that can be avoided, I think that is a discussion worth having, especially with an intervention such as vaccination, which has a really strong and impressive safety track record. So I think that's one of the big reasons is that in order to do our best to prevent some of these longer term outcomes and short term consequences, such as just a child being sick or having to go to the ED, if these outcomes can be prevented with a safe and well tolerated intervention, I think that's a really important thing for families to discuss and strongly consider for their family and children.